Welcome back. Excellent video. Okay, let's now move on to the next part of this morning's proceedings, which is expert discussion between Professor Cary Cooper and Diane Coyle. The subject of their discussion is going to be, can hybrid work improve workers' well-being and productivity? I don't think you could get a more fascinating question, could you, right now? Let me just first of all introduce both of them to you. So Professor Cary Cooper is the 50th anniversary professor of organisational psychology and health at Alliance Manchester Business School. He's a founding president of the British Academy of Management, president of the Chartered Institute of Personnel and Development, and is also a co-investigator for the ESRC for the Productivity Institute. Professor Diane Coyle is the Bennett Professor of Public Policy at the University of Cambridge and a co-director of the Bennett Institute. Diane is theme lead for the Knowledge Capital Research theme of the Productivity Institute and also a member of the Executive Committee. An economist and a former advisor to the UK Treasury, Diane is the author of numerous books and was economic editor of The Independent until 2001. Welcome to you both. Good to see you both. Okay, the idea here really, I think, is for me to let you two do all the talking, because I'm sure you're going to easily fill the next 20 minutes. And I think I first of all just hand over to Cary with a starter for 10. Cary, hi, good morning, first of all, Cary. Nice to see you.
Good morning to you, Jim.
Good morning. As chair of the CIPD, Cary, you've obviously been speaking with CEOs and HR directors throughout the pandemic and about the benefits and pitfalls of hybrid working. From a productivity perspective, what are the issues that are coming out? What are you hearing on the ground from these HR directors and CEOs?
Okay, well, let's start pre-COVID. I mean, the HR profession for the last 10 years pre-COVID has been talking about flexible work. They weren't using the concept of hybrid work, but it was basically flexible work. For those who could do it, there are quite a lot of people can't, have to be at the coal face. Doctors, nurses in hospitals, paste assembly line workers, truck drivers, etc. But the evidence was mounting. And in fact, I did a book called Flexible Work for Routledge, which came out in May 2020, where I asked academics in different parts of the globe, what's the evidence on flexible work? We didn't know that the pandemic was going to come, and the evidence was overwhelming in almost all parts of the world where people could work more flexibly, partly from home, partly from a central office. There was higher job satisfaction, lower stress-related illness. Now, the productivity was more difficult. There was less evidence on that, basically because quite a lot of jobs, it's very difficult to get a measure of productivity for them. But where there was, it enhanced productivity as well. Because basically what it's doing is giving people autonomy and control over their role. I think HR now knows this is doable. The pandemic has convinced employers, by the way, because there's a bottom line for employers, incidentally, which is that they can get rid of some of their capital expenditure or their leases and things. Instead of having 4 floors in London of office space, they may only need 1, because there'll be some people will be in full time. A lot of people will be working from home, so they can save money that way, and also commuting costs, and also the climate change, and all of those kind of factors. So it's coming. There will be issues, by the way. How do we manage people who work in different settings? And that's the issue which we'll discuss maybe a little bit further down the line.
Definitely come back to that. Thanks, Cary. And Diane, a starter for you. You're leading the Knowledge Capital theme at the Productivity Institute. Knowledge provides businesses with competitive advantages, doesn't it? Is there a danger that this gets lost in a world of remote working?
I think so. I mean, first of all, good morning, everybody. I apologise if either the builders or the dog caused some background noise here. This is one of the working from home issues, I suppose. I think it's probably fair to say I'm a little bit more sceptical than Cary about the possibilities of hybrid working or flexible working. And that's because so much of the economy is now a knowledge economy, and it depends on the exchange of ideas between people. And so the issue for me is, how do you retain that organisational know-how? How do you make sure that younger people or newer people in the organisation learn by doing, which is so important at work? How do you ensure that sense of organisational purpose And you know, the transfer of ideas that are probably too small that you wouldn't bother setting up a Zoom to talk to somebody about it, the kind of exchanges that you'd have when you're passing people in the office. And you know, so for example, investment banks operating trading floors consider not only people's presence there, but where they sit and how that affects the flow of information, the flow of business, to be incredibly valuable. You know, we clearly need to understand a lot more about that nexus of well-being and how that relates to being in the office and being at home. But there are lots of issues that perhaps we can pick up, practical issues about equality, gender equality, and so on. So I think it's probably overstated the extent to which we are going to switch to working from home. I'm sure employers will, if they can, take the opportunity to reduce the amount of property that they need to lease. But that in itself has some issues about insurance cover and security and occupational health and so on for the people who are working at home. So I think there's a lot to work through, and I don't think there's going to be a big overnight switch.
Okay, so clearly a slight difference of opinion here. Cary, you mentioned there the monitoring of staff and that whole area. Just expand there a bit more on what your own work has sort of found on that.
If you look at all the research on workplace stress, and there are tens of thousands of studies globally, lack of control on autonomy at work is a big issue. And flexible working allows people to do it. But I agree with Diane, there's going to be kind of issues. And incidentally, I don't think everybody is going to kind of say, well, I'm now working from home substantially. In fact, for job security reasons, I think what's going to happen is going to be phased. Phase one will be everybody want to go back to the office to reconnect, but also for organizational politics. They're going to want to go back and find out if their jobs are secured. So phase one will be everybody will go rush back to the office. Phase two, won't last very long, in my view. A number of people will say, God, this commute, an hour and a half into London, an hour and a half back from London, I don't need it. And we're going to see, once they feel secure in their job, they've understood what's going on in terms of furloughing and whether their jobs are secure in the future. Phase two will be that they will migrate back. In my view, they'll work flexibly. But by the way, flexibly does not mean working 100% remotely. I think people have to understand the construct. Here's the difference, in my view. There's a big investment bank. The chief executive of that investment bank said everybody has to be in the office. The reactions I've had from colleagues, students, HR professionals, that's a disaster for that investment bank in the long run, because people will not, young people will not want to go work there. Now, by the way, young people might want to go work for a short period of time in banks like that, who have that kind of an attitude. The opposite of that is what PwC are doing. And this is the way, this in my view is good HR practice. They're going to each individual and say, given the nature of your role and what we require for you, let's establish a psychological contract. What do you want to do? And for each person, they're going to figure out what suits them and what suits, given their role, and what suits the organization. And that is the way, in my view, to go, rather than either you work 100% remote or you don't work, you work 100% office. We need that kind of mixed economy. The problem will be, and I agree with Diane, there's going to be problems here, by the way. And one of the major problems is the line manager. Line managers are used to people. They want their troops all in one place. They want it in an office setting. They want to be able to call meetings when they're going to call them and everything else. In my view, that's going to be the big issue. We don't have enough EQ'd, emotional intelligent line managers. By the way, my National Forum for Health and Wellbeing, made up of 40 global employers, are all HR directors and chief medical officers, said that is the biggest issue for health and well-being in the workplace and for productivity. The issue is we promote and recruit people for management roles based on their technical skills, not their people skills. That, to me, is the biggest productivity issue from a human capital point of view. I'm worried about that.
I'm sure as a prediction, Cary, that you're correct, but it seems to me to raise lots of really quite deep issues, and the line management one is obviously one of them, and the exchange of ideas. But it also seems to me it merges into this question of what do firms keep in-house and what do they contract out? Because we've already seen in the kind of knowledge jobs that we're talking about really a move towards people operating for themselves, freelancing, and there are questions there about who owns the knowledge and how does that knowledge get shaped. And you see this in some cases in actual disputes over intellectual property. But there's a question for me about what do firms need to know and how do they assemble that knowledge for the collective purpose of the organization? And that I think is a really open question and a very interesting area to research. And I'd link to that this question about well-being and productivity. So individual well-being clearly matters for individual productivity, but how does it operate at the level of the organization? And then at the level of the community and the social context in which people live as well. And so we're clearly going through, because this incredibly difficult year and opportunity to change how we do things, a lot of shifts in that. And I think it's going to be really fruitful for us as researchers to explore what the implications are for productivity and how it manifests itself at these different levels of social organization, if you like.
I totally agree with you, Diane. It's interesting because I have a PhD student, actually not in the business school, in another faculty at the university, who is doing a meta-analysis now, collecting all the data on the link between well-being and productivity. What are all the studies showing? And he's in the social statistics department, social science department. It's going to be quite interesting to see what he comes up with. The number of studies we're finding some, but they're not a hell of a lot. But there are enough, I think, to do a pretty good systematic review. We do need to have that data. We need to know, what's going on. I think, for me, I think the important issue, I guess, in the human capital area is, again, go back to the line manager. I'm kind of worried about that. And when I first started the National Forum for Health and Wellbeing with these 40 global employers 3 years ago, that was their primary issue. They said that's the big issue, why we're not as productive and why stress-related sickness absence. I don't know if you know the figures on that, but the HSC's figures pre-COVID were 57% of all long-term sickness absence was for stress, depression, and anxiety. Big issue.
So it's really interesting. But do you know why companies introduce these line management systems that reduce their productivity? It seems perverse.
Yeah, I agree. Well, think about it though. Most people, we have a pyramidal system of hierarchy to get in most, when you're going in most organizations, from universities to private sector bodies. And how do you move up that pyramid? If you're a great engineer, the way you're going to have to get more money and status and the rest of it is becoming an engineering executive or the top engineer in the organization. It's based on your technical skills. You may get a day or two training on management training here and there, but really being a good engineer, being a good classroom teacher does not necessarily make you a good manager. And we don't, I think, do enough to develop people in this line. And yet productivity is about what Cary Cooper produces based on how I'm managed and the environment I'm operating in. And so to me, that's why it's pretty fundamental.
Have you, so one of the things that concerns me at the moment, looking at the evidence of what happened in a number of countries during the pandemic, is the implication of this shift towards more hybrid working on women in particular, partly because of that loss of visibility in the workplace seems to have a bigger effect on women's promotion and pay, but also because we know that it's still the case that women pick up most of the burden of the household work. And I know this is true of myself as well. On my days at home, and I've been lucky enough to have a day at home for most of my career, I think, oh, I can just go and turn on the laundry because that's my job to do. And there seems to be pretty good evidence that extra burden during the past 15 months has been picked up by women.
Very interesting. And I think when you talk about homeschooling, Diane, what happened during homeschooling, I saw it in one of my kids, who's married, and I saw my daughter, who's a criminal lawyer. I saw her doing a lot more at home than I saw my son-in-law do. And I think this is a real problem area. I think you've hit it. That's an issue I'm kind of worried about. Who took on who continues to take on the household duties and the family duties? It's still women primarily. So what happens when we have more hybrid working is going to be interesting. I'm sorry, dear, I have to go into a meeting at work, but you can work from home. And by the way, can you go pick up my laundry while you get a chance? I mean, I'm taking it down to a human level, but I am worried about that too. I think there are gender issues in hybrid working.
Cary, let's come in a second. You mentioned at the beginning, you felt that you thought there might be quite a rush back, and then people would then come back again. I think that quite a lot of people probably wouldn't agree with that. They might think that, well, are people going to rush back, straight away? I mean, but you sort of think that will happen. And also just related to that, your point about line management, and then just pick up again on something that Charlie mentioned right at the beginning of today's event. You talked about, leadership, management, tech adoption were sort of all big parts of the answers to the productivity puzzle, and leadership clearly there. We're talking about line management being an issue. I mean, you said you're worried, Cary. What are you worried about? You're worried that line managers are just not going to going to everyone come back in the office, or people are going to say no? What do you mean?
No, what I'm worried about the line manager is, say we do hybrid working. I'll get back to your original question about phase 1, phase 2. But if we go back to the line manager, the worry I have is he or she is going to have to manage people remotely. Some young people may be in the office full time. Older people who live further out may want to work primarily from home, but come in a day, 2, 3 days a week. How do you manage that? Number one. Number two, mental health. Biggest issue we've got in the workplace in terms of long-term sickness absence, in terms of presenteeism. The OECD calculated the UK, the year before pre-COVID, lost 4.5% of its GDP due to mental ill health in the workplace. 4.5% of GDP, big time. They did a study of all OECD countries. So I'm kind of worried about, if we don't get the right kind of socially literate and emotionally literate line manager, how are we going to manage people? Some of them are going to be working primarily from home, some are going to be working primarily from an office. How are they going to recognize when people aren't coping, don't have unmanageable workloads? Remember, we're going into a recession. And by the way, that goes back to your first question, why I think it'll be phased, not right now, but as soon as the furloughing stops, as soon as government support for companies stops, and unemployment starts to rise quite dramatically, as it's being predicted, people will want to go back and find out how safe they are from a job security point of view. So they're going to want to go in and take the temperature, the political temperature. Am I vulnerable? Should I be looking for another job? So I think they will go in. That will happen in the next few months, probably in September, not right now, because the furloughing is still going and it's declining and the rest of it. So that's the psychological feeling I have. But that they'll once they feel secure, they'll migrate back, and working with HR, they'll figure a hybrid mode of working.
Diane, do you agree, Diane?
Well, it strikes me there are a couple of issues as we come out of this. One is that, as Cary said right at the start, more than half of the workforce haven't been able to work from home because of the nature of their jobs. So we're only talking about that chunk. But the other is that I think we ought to recognise just the big well-being and mental health hit that the past 18 months has imposed on people. And I know that we've been trying to meet some of our younger colleagues in person as we come out of the lockdown and things ease. And people have put a brave face on it, but actually I think there's been a very real impact. And for all that we talk about the productivity potential of moving to more flexible patterns of working, we're going to have that hit to deal with to begin with.
Diane, you're totally right. The ONS did the ONS look at about 250,000 people quarterly on well-being. And in May of 2020, their report showed that 63% of people were suffering what they perceived as kind of clinical anxiety, depression. I mean, they were feeling big symptoms. So you're right, that is a big issue. But by the way, that was an issue pre-COVID, made worse by the pandemic. Health insecurities, job insecurities are not going to help that either.
Okay, Diane, just wanted to come back to you on that point also that Cary made around each person sort of having their own individual assessment of how they're going to work in the future, and that, I mean, perhaps aligns to your point about knowledge capital and how some workers, yes, it will be more important to return to office than others. What are your thoughts on that?
the question to me is how you get people working together in the teams that they need. And there's a lot of individual variation, so I think it's quite hard to generalize. And just thinking about my own part of the knowledge economy and research, there are people who are quite introverted and they've been perfectly happy working from home. It suits them fine. There are others who it doesn't suit so well for, if you like, personality reasons. But there's also the need for teams to work together. More and more research is done in teams. A lot of professional services work in teams, or financial services. And so the challenge, I think, is more than just line managers having the emotional intelligence to handle that, but just the practical organizational business of how do you get the teams that need to talk to each other together in person. And it's almost like the complicated timetabling problem that schools have when they're trying to sort out what subjects pupils can do. Maybe somebody's going to invent some clever software that allows you to manage your teams in that way. But they do need to get together. And only this week, we had a meeting of a few of us in person for the first time in months. And the conversation that you have is just much richer. I think a lot of people will discover that. And that's one of the management challenges as we emerge.
And finally, Cary, we've got a minute left, so Cary, does come back on that final point there from Diane?
Oh no, I think she's right. But you know what I think as well, Diane, which really impresses me, what the pandemic I think has done, though, from a positive point of view, it's maybe makes us appreciate what we took for granted, our relationships with people. I think our relationships will improve enormously. I noticed during this pandemic, I've talked to colleagues about issues, personal issues, about how they were feeling and everything else, more than I ever did. Knew more about their families than I ever did. And I think maybe that's been the benefit of this indirectly. And I hope that goes into the workplace as well. Will mean as well that people will want to go back from time to time. Even people who could work 100% remotely won't want to do that. They'll want to go in for the social connectedness, if nothing else.
Well, we need to take the benefit that we can out of this episode.
We do.
We did actually have I'm afraid we're running out of time here. We did actually have some questions come in as well on this, but what we'll do is we'll make sure we pass them on to you both, and you can both reply to those questions. So sorry, as I said earlier, that we could probably have a whole day of debate about these issues because they're so important. But now I do have to move on. So can I thank you both, Cary and Diane, for fantastic discussion there. I think all our listeners will have found it a very interesting and fascinating discussion. And let's see, perhaps we should bring you back again in a year's time and see where we are then in terms of the hybrid working. But thanks to you both.
Thanks, Jim. Thank you very much. Take care, Diane.
Okay.
Speak to you soon.
Yeah, you too.
Okay.